Bismillahirrahmanirrahim. Dear students, welcome to my 13th class, which is related with Unit 2. So, in this unit, we have already discussed about the different type of anesthetic agents, general anesthetic agent and local anesthetic agents. So today the topic which I am going to present, that is the depth of anesthesia. What is depth of anesthesia? So depth of anesthesia, it is the degree to which the central nervous system is depressed. Now how is it possible? Look at this sketch. In this sketch it has been seen that in first category there will be loss of pain sensations, and look at in second category the combative behavior shown by this person, and third category surgical anesthesia, and fourth medullary paralysis and death. The usual parameter for individualizing anesthesia. Depth of anesthesia, stages of anesthesia. So today we will talk about the different type of stages of anesthesia. Whenever we are going to administer general anesthetic agent to the patients. So the first one is in stages of anesthesia. The first one is stage 1 is analgesia. Stage 2 is excitement, stage 3 is surgical anesthesia, stage 4 is medullary paralysis. These are the stages of anesthesia. So the first one is stage 1 analgesia. So in stage 1 analgesia, so first of all, there will be loss of sensations of pains. The patient will lose the sensation of pain. Whenever the perception of pain, so it will become reduced. The patient there will be complete loss of pain sensation, because during anesthesia our main target is to block the pain sensations. And stage 1 anesthesia, the second one is drowsiness maybe occurs, while in third case amnesia, temporary loss of memories and reduce the awareness of pain. This is stage 1 analgesia. So one is analgesia and the second one is algesia. Analgesia means loss of pain sensations, and algesia means to feel pain sensations. And stage 2, stage of excitement. This is called stage of anesthesia and is called stage of excitement. So in stage of excitement there will be a condition like delirium. So delirium, it is the condition, or you can say the sudden state of severe confusion and rapid change in the brain's functions. That is called delirium. Rise and irregularity in blood pressure and respirations may be occur in stage of excitement. In third case, there may be chance of risk of laryngospasms. The fourth one is to shorten this period. A rapid acting anesthetic like Propofol, which is available in a market by trade name Propofol, is administered intravenously before inhaled anesthetic. Before administration of inhaled anesthetic, Propofol can be administered intravenously in order to shorten this period. Rapid acting anesthetic like Propofol can be administered. The third one is stage 3. In stage 3, so the third one is called surgical anesthesia. In this stage, there will be loss of muscle tone and reflexes of the patient. While in second case, this is the ideal stage for surgery. The stage of stage 3, which is called surgical anesthesia, this is the ideal stage for surgery. While the third one is requires careful monitoring. So this is very important, is because you are going to monitor the surgical procedures or the anesthetic drug which is given to the patient. So it is very important. So it need very technicals, and you can say required a skillful person to monitor and control it. Stage 4 is called medullary paralysis, and medullary paralysis, severe depression of respiratory and vasomotor centers is occurred in stage 4. This is called stage 4 is called stage of medullary paralysis. So death can occur unless the respirations and circulation are maintained. If the respiratory centers and circulations they are maintained, so it means that the chances of risk it will be minimized, and death may occur unless the respiration circulation they are maintained. And severe depression of respiratory and vasocenter. As we know that there are different type of anesthetic agents which are used. So in anesthetics, the potent general anesthetics they are delivered via inhalation or IV injection, so it may be administered in inhalatory form or injectable form. The inhaled general anesthetic, and the second one is intravenous general anesthetic, and the another one, this is local anesthetic agents by which we can target the local area, especially for example when there is pain sensation, and we can and which when there is local areas involved, so we can anesthetize that local area, while in general anesthesia your whole body had become anesthetized. Inhaled anesthetics, these are the drugs which are classified into different categories. Look at here, the first one is desflurane. This is inhaled anesthetics. So it can be given to the patient through inhalatory route. That may be desflurane, halothane, isoflurane, sevofluranes, and nitrous oxide. So these are the agents. These are the inhaled anesthetics which are used during administration of anesthesia. So this is the anesthesia gas machine. Look at here, and this is the person. And with the anesthetic condition they are maintained here. This is systemic circulation and the brain of the person. Volatile anesthetics delivered to the patient, so they are absorbed by lungs into the systemic circulation, causing dose dependency and depression. Inhaled anesthetics, they are used for maintenance of anesthesia after administration of an IV agent. The depth of anesthesia can be altered rapidly by changing inhaled concentration of the drug, the neurotherapeutic index from 2 to 4. The difference between the dose causing no effect, surgical anesthesia, and severe cardiac and respiratory depression is small. No antagonists exist. Now look at here. An inhaled anesthetic, the potency, the power of the inhaled anesthetic, so that can be defined as the minimum alveolar concentration. What is MAC? MAC is actually the concentration of the anesthetic gas which is needed to eliminate the movement among the 50% of the patient. So as we have already discussed that before giving any anesthetic agent to the patient, so the skeletal muscle of the patient, so they are not relaxed. So here in this case in MAC, the concentration of the anesthetic gas from the machines needed to eliminate the movement among 50% of the patients. Moreover, I would like to say it is expressed as the percentage of the gas in a mixture required to achieve the effect, mean the therapeutic effect, the effect which you want, which you desires. The smaller is the minimum alveolar concentration, so more potent is the drug. So what does it mean? It means that low dose of a drug is more potent than higher dose. As I have already discussed, whenever you are going to exceed or increase the concentration of the drug, so definitely its ADR, adverse drug reaction, will be increased. So in order to minimize the chances of toxicity, you will have to adjust the dose. So smaller is the minimum alveolar concentration, is more potent than drug. Nitrous oxide alone cannot produce complete anesthesia. It means this point is clear that nitrous oxide cannot be used alone. It can be given in combination with other inhaled anesthetics in order to anesthetize the patient. Inhaled anesthetics, The more is the blood solubility, so more is the anesthetic dissolve in the blood, and longer is the induction and recovery time needed, and slower changes in the depth of anesthesia occur as we change the concentration of the inhaled the drug. So definitely, so greater will be, more will be the blood solubility, so more anesthetics agents will be dissolved in the blood, and definitely so it will take long period of time, and longer is the induction and the recovery time needed, and slower in the changes, definitely changes in the depth of anesthesia. Now look at here the comparison. So the activity of halothane. So the halothane activity, so that is already it mean that is greater than isoflurane, and then isoflurane's inhaled anesthetic activity is greater than sevoflurane, and sevoflurane's anesthetic activity is greater than nitrous oxides, and then nitrous oxide is greater than desflurane. So look at this is type of ending, inshallah, in my upcoming lectures. So I will explains more and more about the different type of agents which are used in anesthetic anesthesia. As we know that cardiac output affects the removal of anesthetic to peripheral tissue, not the site of action. The higher is the cardiac output, mean the more is the anesthetic is removed. Let's suppose if the cardiac output of the patients is increasing, so it is very important that we should remove the anesthetic agent, and the slower is the induction time. Mechanism of action, mode of action of inhaled anesthetics. It means that there is no specific receptor has been identified still is the locus of general anesthetic actions. So it is not necessary that there will be a receptor for each drug that will bind with the receptor and to show some pharmacological response. But here in this case, the anesthetics, the inhaled anesthetics, it can increase the sensitivity of GABA receptor. You know GABA receptor. So GABA receptor are actually gamma aminobutyric acid. So these are the receptor. Most of the benzodiazepines, especially most of the sedative hypnotics, like you can take the classical example of diazepam. So diazepam, we know that is sedative hypnotic agents as well as skeletal muscle relaxant, so it can potentiate the inhibitory effect of the, you can say, GABAergic receptor. So actually these drugs may increase the sensitivity of GABA receptor, gamma aminobutyric acids, to the neurotransmitters like acetylcholine, GABA, which prolonging the inhibitory chloride ion current after GABA release and reducing the post-synaptic neuron excitability. Inshallah, in my upcoming lecture, inshallah, I will tell you about the action potential, how action potentials can occur and how depolarization and repolarization can occur, and the sodium goes inside and potassium goes outside. So then I will, if these points should be clear to you people, so I think it will be easy to you to know about the mechanism of action of different drugs. Anesthetics increase the activity of inhibitory glycine receptors, especially which are found in the spinal motor neuron. Anesthetics block the excitatory postsynaptic nicotinic current. So inshallah I will also tell you about nicotinic receptor and muscarinic receptors, and there are different type of receptors which are present in different organ and they are distributed. The mechanism by which the anesthetic perform these modulatory roles, it is still not clear. Now come to halothane. So halothane, it belongs to inhaled anesthetics. So halothane, this is the potent anesthetics and weak analgesic drug. It means it is potent anesthetic, but its analgesic activity is low. So it is administered in a combination with nitrous oxides, opioid or local anesthetics, being replaced by other agent due to its adverse effects. Now it has been replaced due to its adverse effect. The adverse effects which are reported after administration of halothanes. So cardiac effects which are reported after administration of halothanes. So it may cause vagomimetic effect. So vagomimetic effect is actually when there is occur stimulation of the vagus nerves or bradycardia, or decrease in heart rate can cause cardiac arrhythmia. So these are the AD or adverse drug reaction which are reported after the administration of halothane. Another adverse drug reaction which is reported, that is malignant hyperthermia, and which is a rare and life-threatening condition, and uncontrolled increase in skeletal muscles oxidative metabolism, which overcome the body capacity to supply oxygen and remove the carbon dioxide and regulate the body temperature. If untreated, so would cause circulatory collapse, shock, and there may be chances of coma and death. And the simple treatment is dantrolene administration. Let's suppose if overdosing occur, if halothane overdosing occurs, so in that case dantrolene can be administered. Another anesthetic agents, inhalatory anesthetic agents, that is isoflurane. And isoflurane undergo the lethal metabolism, not toxic to the liver or kidney, doesn't induce cardiac arrhythmia. It produces dose-dependent hypertension due to peripheral vasodilatations. Desflurane is another inhaled anesthetic agent. It provides very rapid uncertain recovery due to its low blood solubility and the lowest of all the volatile anesthetics. Especially desflurane is the most popular anesthetic agents for the outpatient surgery, but it can also irritating to the airway and can cause laryngospasms, coughing, and excessive secretion may be occur. Degradation is minimal, but tissue toxicity is rare due to desflurane. So I mean that desflurane it provides a very rapid onset and recovery due to its low blood solubility and the lowest of all the volatile anesthetics. Another inhaled anesthetic which is used during to anesthetize the patient, so that is sevoflurane. And sevoflurane actually at his low pungency allowing rapid induction without irritating the airway, making it suitable for inhalation induction in pediatric patient. So sevoflurane, this is also one of the effective inhalatory anesthetic agents, especially it causes rapid induction without irritating the airway by making it the most suitable candidate for the inhalation induction, especially in pediatric patient, especially in children. Sevoflurane can be preferred, replacing the halothane for this purpose. So in case of pediatric patients, so halothane can be replaced and sevoflurane can be used. So their metabolism, so it can be, sevoflurane can be metabolized by the liver and the compounds formed in the anesthesia circuit. It may be nephrotoxic. Another agent that is called nitrous oxide. Nitrous oxide is also belong to it also belongs to inhaled anesthetics. So nitrous oxide is non-irritating and a potent analgesic, but a weak general anesthetic agents. So nitrous oxide, they are frequently employed at the concentration of 30 to 50% in a combination with oxygen for analgesia, particularly in dental surgery. So I mean this agent is also used especially frequently, which is implied at his weak general anesthetics properties, but especially nitrous oxide, it can be recommended particularly in dental surgery, because in dental surgery you are going to target the local area, so there it also come under the category of, so it means at a strong analgesic activity, local analgesic activity. So this drug can be given under the concentration of 30 to 50% in a combination with oxygen for analgesia, and particularly in dental surgery. Nitrous oxide almost at 80% without adjunct agents cannot produce surgical anesthesia. This drug will be combined with more potent agents to attain the pain-free anesthesia. The simple mechanism of action or mode of action of nitrous oxide is unresolved, but it mildly involve the activity on GABAergic receptor, gamma aminobutyric acid, and the second one is NMDA receptor, Actually, NMDA receptor, these are N-methyl-D-aspartate receptors. So it can directly act upon on these receptors, just like benzodiazepine, as I have already discussed. GABAergic receptor like diazepam, which can potentiate the inhibitory effect of the GABAergic receptors. Nitrous oxide is least hepatotoxic of all inhaled anesthetics. How much inhaled anesthetics we are using for the induction of anesthesia, so it will produce least hepatotoxic, mean it is less hepatotoxic, less toxicity. Now come toward the second group, that is called intravenous anesthetic agents. So intravenous anesthetics actually used in a situation that required the short duration anesthesia, that is called intravenous anesthesia, especially in outpatient surgery. They are primarily used as an adjunct to the inhalationals, administered first and rapidly at induce, produce or cause unconsciousness, and low doses they may be used to provide sedation. IV anesthetics, actually these are the group of anesthetic agent which cause induction after entering into the bloodstream, because IV anesthetics can be injected directly into the vein. So after entering into the bloodstream, a percentage of the drug bind to the plasma protein and the rest remain unbound free. The drug is carried by the venous blood to the heart, and the majority of, you can say, carbon monoxide, 70% flow to the brain, liver and the kidney. So this is also very important point. So once the drug has penetrated in the central nervous system tissue, so it exerts its effect. The exact mechanism of action of IV anesthetic is unknown, but I would like to say, so all these drugs can act on GABAergic receptor, gamma aminobutyric acid. Recovery from IV anesthetic is due to redistribution from the sites in the central nervous system, CNS. Now these are the agents. These are the intravenous anesthetics which are used to cause induction anesthesia of the patient. So these are the agent. Look at here. IV anesthetics, they are categorized into different categories. So the first one is Propofol, which is available in a market by Fofol, PAS, Propofols, barbiturates, benzodiazepine, opioid, and ketamine. So all these drugs, they are used as a anesthetic agent, as a general anesthetic agents, and they are available in the form of infusion. So it can be injected to the to the patients in the form of infusion. Now come toward the first drug is Propofol. So Propofol, that is called IV sedative hypnotic, used in induction or maintenance of anesthesia. So Propofol, it can be administered intravenously, that is hypnotic, used in induction, and maintenance, that is used for the maintenance of anesthesia. Widely used and has replaced thiopental as the first choice for the inductions, for the anesthesia induction and sedation, because it doesn't cause post-anesthetic nausea and vomiting. So the main quality, the main property of this drug, Propofol, it is the most suitable candidate which is widely used, and it has now replaced the thiopental. So it is the first choice for the anesthesia induction because it causes sedations, and as well as due to some peculiar property, it doesn't cause post anesthetic nausea and vomiting. So Propofol, actually this is the most suitable drug because it doesn't produce any post-anesthetics, nausea and vomiting, and the induction of anesthesia occur within almost 30 to 40 seconds of administration. The supplementation with narcotics for analgesia is required. Propofol decreases the blood pressure without depressing the myocardium. It also reduces intracranial pressure due to systemic vasodilatations. Past Propofol, it is approved only for sedations. It is a prodrug of Propofols. Barbiturate, this is another category. You can say this is also, barbiturate is also available in the form of IV infusion. So intravenous anesthetics, it comes under the category of So barbiturates are barbituric acid. Barbiturates, they are not significantly analgesic. It requires some type of supplementary analgesic administration during anesthesia to avoid the objectionable changes in the blood pressure and autonomic function. It can cause apnea, causing chest wall spasm, laryngospasm, and bronchospasm. Another agent that is called thiopentol, so this also calls it also come under the category of IV anesthetics. So thiopentol is a potent anesthetic but a weak analgesic. So it is it is strong anesthetic activity but weak analgesic activity. Ultra short acting barbiturates. It also comes under the category of ultra short acting barbiturate. It has minor effects on the cardiovascular system, but it may contribute to severe hypotension in the patient with hypovolemia or shock. All the barbiturates. Benzodiazepine, they are used in conjunction with anesthetic to sedate the patient, to produce sleep in the patient, like Midazolam Diazepam Lorazepam. So it facilitate, as usually all different type of anesthetic agents used, but they are used in a combination with other drugs, because a single drug, it doesn't perform any activity. So to facilitate amnesia while causing sedation. The mechanism of action or mode of action of simple benzodiazepines, so they have the capability to increase the inhibitory effect of various neurotransmitters. It means that it can increase the inhibitory effect of the various neurotransmitters like acetylcholine, so particularly GABA immunobutyric acids, and it causes minimal cardiovascular depressant effect, and it is not potential respiratory depressant. So it may also depress your respiratory. It may cause respiratory depressions, and it can induce a temporary form of anteregrets amnesia, in which the patient retains memory of past event, but new information is not transferred into long-term memory. The important treatment information should be repeated to the patient after the effect of the drug have worn off. Now come toward another group that is called opioids. As we know that opioids are actually those drugs which cause sedations as well as to relieve the pain sensation, so commonly used with anesthetic due to their analgesic property. The choice of opioid use perioperatively is based primarily on the duration of action which is needed. That is fentanyl and remifentanil. So it also comes under the category of opioids. So it induces the analgesia more rapidly than morphine. So morphine, we know that morphine, it is one of the potent analgesics, but due to some cascade reaction, due to some ADR, adverse drug reaction, morphine, it causes respiratory depressions and hypotension. So due to which the morphine is now banned, so it cannot be used in anesthesia. So it can be administered intravenously. So it can be directly administered intravenously, epidurally, and intrathecally. They are not good amnesic agents. It can cause hypotension, respiratory depression, muscle rigidity, and post-anesthetic nausea and vomiting. Opioid effect can be antagonized by naloxone. Let's suppose if opioid overdosing occurs, so what will be happens? So if opioid overdosing occurs, so this overdosing can be minimized by antagonize its effects by naloxone. So naloxone is actually antidote for opioids. Another agent that is called ketamine. So ketamine is actually it also comes under the category of intravenous anesthetic agents, and ketamine is a short acting non-barbiturate anesthetics, because ketamine is used for short procedures and it induces or cause a dissociated state in which the patient is unconscious, but it may appear to evoke in doses not feel pain and the patient doesn't feel anything. So this dissociative anesthesia provides sedation, amnesia, and immobility. interact with N-methyl-D-aspartate receptor. So ketamine, the major mechanism of action, mode of action of ketamine, so it can stimulate the central nervous system, the central sympathetic outflow, which is turn and cause stimulation of the heart with increase the blood pressure and cardiac output. So it is beneficial, and the patient, especially a patient with hypovolemic or cardiogenic shock, and especially in a patient with asthma. Let's suppose if a patient, if there is an asthmatic patient, a patient who is suffering from asthma, or the patient who is affected by cardiogenic shock or hypovolemic shock, so in that condition the ketamine will be prepared. They are not used in hypertensive or stroke patient. It cannot be given to the stroke patient, but they are beneficial, especially they are important for those patients who have hypovolemic shock, cardiogenic shock, and the patient especially with asthmatic condition, asthma, respiratory failure, who have difficulty in breathing. It causes post-operative hallucinations. Paralytic or neuromuscular blocking agent, they are also used. So paralytic or neuromuscular blocking agent, they are used to stop the reflexes, to facilitate the tracheal intubation, and to provide the muscle relaxation or needed for the certain types of surgery. So the mechanism of action of neuromuscular blockers, actually neuromuscular blockers agents, they are used for what? They are used to normalize, to relax the skeletal muscles. The mechanism of action of neuromuscular blocking agents, so they are actually at block, they are responsible to cause blockage of the nicotinic receptor, actually nicotinic acetylcholine receptors, and the neuromuscular junctions. As we know that normally the acetylcholine, so these are the neurotransmitter which are released, but it is very important to minimize or to control the release of acetylcholine. So these neuromuscular blocker agent, it can block the nicotinic acetylcholine receptor in the neuromuscular junctions. For example, so these neuromuscular blocker agents, it include phencoroniums, rocuroniums, and succinylcholines and vecuronium, as I have already discussed in my previous lectures. Now come toward local anesthetic agents. So local anesthetic agents, as we know that local anesthetic agents, it may be in the form of amides, like lidocans and ester, procan, benzocans. So these are local anesthetic agents. So local anesthetic agent, it causes the loss of sensation and in higher concentration motor activity in a limited area of the body, because it causes local blockage of the any area of your body. So it is applied or injected to block the neuroconduction of the sensory impulses from the periphery to the central nervous system, because in this case in local anesthetics we are going to target that particular area of the body. Procan, lidocaine. So lidocaine, it come under the category of amide group, and procan come under the category of ester group. Local anesthetic agent, the mechanism of action, the mode of action of local anesthetic agent is, so local anesthesia is produced or induced when the propagation of action potential is prevented. So we are going to prevent the action potentials. So when action potential can take place, so there will be hyperpolarizations, depolarization, repolarization, so the sensation cannot be transmitted from the source of stimulation to the brain. So here in this case, in local anesthetic agents, when we are going to administer local anesthetic agent, so they are going to block block the action potential, which is prevented. If the action potential it doesn't generated, so it will definitely block the sensation. It cannot be transmitted from the source of stimulation to the brain. The simple mechanism of action of local anesthetic agent, it can work by blocking the sodium ion channels. So simple, the local anesthetic agent, it can block the sodium ion channels in order to prevent the transient increase in the permeability of the neuromembrane to the sodium that is required for an action potential to occur. Then inshallah I will clear the concept of action potential, resting membrane potentials. Inshallah I will discuss each and everything then, and inshallah in my physiology class. Now what are the different type of local anesthetic agents which are used during anesthesia? So the first one is lidocaine, the second one is bupivacaine, the third one is provocaines and ropivacaines and tetracaine and mepivacaines. So they are not used in obstetric anesthesia due to increased toxicity to the neonate. These are the local anesthetic agent, but it cannot be used especially in gynecological examination, gynecological cases, because it may increase the chances of risk, especially to the neonates. Local anesthetic agents are usually local anesthetics cause vasodilatations. Local anesthetic agents cause vasodilatation, which lead to the rapid diffusions away from the site of action and result in the short duration of actions. By adding the vasoconstrictor epinephrine to the local anesthetic, so the rate of local anesthetic diffusion and absorption is decreased. So simply whenever we are going to administer local anesthetic agent, so it will cause vasodilatation and the blood vessel it become dilates, so it will definitely lead to rapid diffusions away from the site of action and result in short duration of action can be occurred and the conditions become minimized. So this both minimize the systemic toxicity and increase the duration of action. Local anesthetic agent का सबसे बड़ा फायदा है कि ये duration of action को exceed करता है and this both minimize the systemic और इसमें toxicity के chances भी कम होते. Topical anesthetics. अब topical anesthetics क्या है? तो topical anesthetics actually they are applied directly to the skins and mucous membrane. Topical जितने भी anesthetic वो हम skin पे लगाते हैं, इसके अलावा mucous membrane पे हम लगाते हैं, अप्लाई करते हैं. बेंजोकेन इज द मेजर ड्रग इन दिस ग्रुप. टॉपिकल एनेस्थेटिक में सबसे जो मेजर ग्रुप है उसमें वो क्या है? वो आपका बेंजोकेन है. सो बेंजोकेन इज द मेजर drug in this group. Lidocaine and tetracaine can be also used topically. इसके अलावा हम lidocaine और tetracaine भी ये भी हम topically use करते हैं. They are used to relieve or prevent the pain from the minor burns, irritation and itching. So simply the topical anesthetic agent they are used to relieve and prevent the pain from the minor burn or irritation. They are also used to numb an area before injection to the given, especially जिस जगह पे हम इंजेक्शन लगाते हैं, ठीक है, जनरल लोकल एनेस्थेटिक्स टू इन ऑर्डर टू एनेस्थेटाइज दैट लोकल एरिया, ठीक है. तो जब वो हम लगाते हैं तो आपका वो जो लोकल एरिया होता है वो उसमें नमनेस जैसा पैदा होता है, फिर उसमें पेन सेंसेशन नहीं होता. So expected adverse effects involve skin irritation may be occur and hypersensitivity reaction may be occur. So thank you so much for watching my lecture. Inshallah, if you need more detail, inshallah in my next lecture I will clear each and everything, inshallah, and now waiting for my next lecture. Thank you so much for watching this presentation.